Plastic surgery is practically a job requirement for Real Housewives, but some have taken it way too far. From overfilled lips to unrecognizable faces, these 7 housewives went under the knife so many times they destroyed their natural beauty. Here's who ruined their faces chasing perfection and now regret it. 1. Kim Zolciak. Kim might be the most shocking plastic surgery transformation in Real Housewives history. The former Real Housewives of Atlanta star looks nothing like she did when she first appeared on the show back in 2008. Her face has changed so drastically that fans often don't recognize her in recent photos. During a 2025 appearance on Botched Presents, Plastic Surgery Rewind, Kim admitted to getting her boobs done multiple times, a tummy tuck, lip fillers, and regular Botox injections. But that's just what she admitted to publicly. Comparing photos from her RHOA days to now shows clear evidence of much more work, including likely cheek fillers, a nose job, and possibly even a facelift. The most obvious change is Kim's face shape, which has become noticeably fuller and rounder over the years. Her lips are significantly larger than they were naturally. Her cheeks appear plumper and higher, her nose looks thinner, even her hairline seems different. The cumulative effect makes her look like a completely different person. What makes Kim's situation worse is that her daughter Brielle Biermann started getting procedures at a very young age, following in her mother's footsteps. Kim has been criticized for normalizing excessive plastic surgery to her children. On the Botched special, Kim revealed she was dealing with loose skin after weight loss during her divorce from Kroy Biermann. She'd gotten arm contouring that was supposed to tighten the skin, but it did the opposite, leaving her with sagging arms. The problem with Kim's approach to plastic surgery is that she keeps trying to fix procedures with more procedures, rather than accepting natural aging. Each new treatment seems to make things worse instead of better. Fans who followed her journey from RHOA to Don't Be Tardy to now say she was most beautiful in her early seasons before all the work. The excessive fillers and procedures have left her looking puffy and unnatural compared to her original features. 2. Brandi Glanville. Brandi Glanville from Real Housewives of Beverly Hills has been shockingly honest about her plastic surgery regrets, admitting she went way too far with fillers and Botox. In interviews, Brandi confessed that she has definitely overfilled and had some bad Botox where your eyes drop, which sounds absolutely terrifying. Looking at photos of Brandi from her early RHOBH seasons compared to more recent appearances shows dramatic changes. Her face appears much fuller and puffier than it did naturally. Her lips are significantly larger. Her cheeks look overdone. The work she's had makes her look older rather than younger, which is the opposite of what plastic surgery is supposed to achieve. What's particularly sad about Brandi's situation is that she's acknowledged the problem but seems unable to stop. She's talked about having procedures dissolved and corrected, but then she goes back for more work. It's a cycle that many housewives get trapped in, where they become addicted to tweaking their appearance, even when the results are clearly making things worse. Brandi has also admitted to procedures beyond her face, including vaginal rejuvenation surgery that she got as revenge after her husband Eddie Cibrian cheated on her with Leanne Rimes. She wrote about this in her book Drinking and Tweeting. The fact that she was getting cosmetic procedures out of anger and hurt rather than genuine desire shows how emotions can lead to bad plastic surgery decisions. In recent years, Brandi's appearance has been so dramatically different that fans express concern on social media whenever new photos emerge. Her face looks swollen and tight in a way that suggests too much filler. The natural movement and expression in her face seems limited. If we had to guess, we'd say she walked into her surgeon's office and said, "Give me one of everything," because even her hairline looks different now. 3. Vicki Gunvalson. Vicki Gunvalson, the OG of the OC from Real Housewives of Orange County, has been remarkably open about all the work she's had done. In a 2017 interview with People magazine, Vicki admitted to having her upper and lower eyes, her nose, and her chin all done in the past 4 or 5 years. That's a lot of facial surgery in a very short time period. The problem with getting multiple procedures done close together is that your face doesn't have time to settle between surgeries. Each new procedure changes the foundation that the previous work was based on. The result is a face that looks overdone and unnatural. Vicki's transformation photos show exactly this problem. Her face appears noticeably tighter and smoother than someone her age would naturally look. Her eyes have a pulled appearance from the upper and lower lid work. Her nose is thinner, her chin is more defined. While each individual procedure might look okay on its own, altogether they create an overly surgical appearance that screams, "I've had work done." Vicki also admitted to getting cheek implants, fat transfer to her face, and a lower facelift. Again, that's an enormous amount of facial alteration. The Vicki Gunvalson who appears in recent seasons of RHOC looks dramatically different from the woman who started the franchise back in 2006. Some fans argue she's unrecognizable. What's concerning about Vicki's plastic surgery journey is the speed at which she did everything. Getting multiple facial procedures in just 4 or 5 years doesn't give your face time to age naturally between interventions. It creates a situation where you're constantly chasing an ideal that keeps changing as your face heals from the previous surgery. The result is a face that looks artificial rather than naturally refreshed. 4. Jacqueline Laurita. Jacqueline Laurita from Real Housewives of New Jersey used to look like a fun Jersey girl who knew how to make delicious marinara and would never ask if pasta was gluten-free. But after years of plastic surgery, she now faces brutal criticism on social media every time she posts photos. In December 2016, Jacqueline posted before and after shots of her eye lift procedure to Facebook, claiming she got a good deal in exchange for marketing her doctor's services. Followers were absolutely not having it. The backlash was intense, with fans accusing her of getting free procedures while complaining about her family's financial struggles on the show. Jacqueline has also admitted on Twitter to getting a breast reduction and a nose job. She's even mused about doing something to her lower face, which was met with similar criticism from fans who felt she'd already gone too far. The problem is that each new procedure changes her appearance in ways that don't necessarily improve her looks. What makes Jacqueline's situation particularly difficult is the timing. She was very open on RHONJ about her family's financial problems. Watching her get expensive cosmetic procedures while claiming to struggle with money made fans angry. They felt she had misplaced priorities and should be focusing on her family's needs rather than vanity procedures. The eye lift she documented seemed to pull her eyes in an unnatural way. Fans commented that she looked constantly surprised or startled. Her nose job changed the character of her face, making her look less like the authentic Jersey girl she'd been, and more like she was trying to fit a Hollywood ideal that didn't suit her natural features. Even though she's already made a big transformation, Jacqueline seemed to just be getting warmed up, which worried fans who felt she was heading down a dangerous path of surgical addiction. 5. Kyle Richards. Kyle Richards from Real Housewives of Beverly Hills is interesting because she's denied having facial surgery for years, attributing changes in her appearance to makeup tricks like turning the ends of her fake eyelashes up a little bit. But comparing photos from season 1 of RHOBH to recent seasons shows clear evidence of work beyond just clever makeup. Kyle has admitted to getting breast implants and breast augmentation, so she's not completely against plastic surgery. But she's been very defensive about accusations of facial work. The problem is that her face looks noticeably different, her nose appears more refined, her lips look fuller, her cheeks seem higher. Her skin has that tight, smooth appearance that comes from procedures rather than just good skincare. What makes Kyle's situation controversial is the denial. If she's had work done, just own it. The constant insistence that it's all makeup and good lighting makes fans more critical when they can clearly see changes. It comes across as dishonest rather than private. The changes to Kyle's face have been gradual over her 14 seasons on RHOB, which is actually smarter than getting everything done at once like some housewives do. But the cumulative effect is still noticeable. Her face in season 15 looks significantly different from her face in season 1, and not in ways that natural aging explains. Fans have particularly noted changes to Kyle's nose, which appears thinner and more sculpted than it did originally. Her lips have visible plumpness that wasn't there before. Her jawline is sharper and more defined. These are all signs of cosmetic intervention. While Kyle hasn't ruined her face to the extent that some housewives have, the work she's likely had done has changed her appearance in ways that make her look less natural and more maintained. 6. Lisa Hochstein. Lisa Hochstein from Real Housewives of Miami is married to plastic surgeon Dr. Leonard Hochstein, which means she has unlimited access to cosmetic procedures. Unfortunately, having easy access doesn't mean using it wisely. Lisa's appearance has changed dramatically over her years on the show. Lisa got her breasts done at age 19, and decades later her husband corrected them because she said they were lopsided. She also went larger in size. Beyond her breasts, Lisa has admitted to a rhinoplasty a long time ago. In a 2017 interview, she claimed the nose job didn't change her face that much and insisted she'd had less plastic surgery than most housewives. But that interview was years ago. And photos from recent seasons show significant additional work. Her face appears much fuller and tighter than it did in earlier appearances. Her cheeks are noticeably plumper. Her lips are larger. Her skin has that stretched, shiny quality that comes from too much intervention. The irony of Lisa's situation is that being married to a plastic surgeon should mean having access to the best advice about when to stop. But it seems like the opposite happened. Having a surgeon at home made it too easy to keep getting procedures without the natural barriers that might make someone else pause and reconsider. Lisa's transformation photos are dramatic. The woman who appears in recent seasons looks like a different person compared to early photos. While she hasn't reached the extreme levels of someone like Kim, the work she's had done has definitely changed her face in ways that make her look more plastic and less natural. Of all the housewives on this list, Lisa might be the most open about the work she's had done, but that openness doesn't change the fact that the results haven't been flattering. 7. Tamra Judge. Tamra Judge from Real Housewives of Orange County has been very public about her plastic surgery journey, sharing graphic recovery photos and videos with her fans. But sometimes being open about procedures doesn't make the results any less shocking. In August 2024, Tamra took advantage of a holiday weekend to get some extreme cosmetic work done. She underwent a brow lift and a CO2 laser treatment with a blue chemical peel. The 57-year-old shared videos from her recovery, and fans were genuinely frightened by what they saw. Her face was bright blue from the chemical peel, and the swelling was so severe she looked unrecognizable. 7 years earlier, Tamra had gotten a lower facelift but skipped the upper, which she compared to painting the house but forgetting the trim. So she went back to complete the job. The problem is that adding more procedures to fix previous procedures often leads to an overdone appearance rather than a naturally refreshed look. Tamra also removed her breast implants in 2021 after experiencing symptoms of breast implant illness. She had undergone 5 breast surgeries throughout her life, including multiple augmentations, lifts, and explantations since her early 20s. That's an enormous amount of surgical trauma for one body part. The combination of multiple facial procedures, aggressive chemical treatments, and repeated breast surgeries has left Tamra looking significantly different than she did in early RHOC seasons. Her face appears tight and pulled. Her skin has that overly smooth, waxy quality that comes from too many treatments. While the swelling from her most recent procedures will eventually go down, the fundamental issue remains. She's had too much work done too aggressively. What's particularly concerning about Tamra's approach is the intensity of the procedures she chooses. CO2 laser treatments with chemical peels are serious interventions that require significant recovery time. Brow lifts change the entire expression of the face. Combining aggressive treatments like this can lead to results that look harsh rather than subtle and natural. Looking at all 7 of these Real Housewives, a clear pattern emerges. They all started with good intentions, wanting to look their best on camera and maintain their appearance as they aged. But somewhere along the way, they crossed the line from enhancement to alteration. They went from looking like better versions of themselves to looking like different people entirely. The problem with plastic surgery addiction is that it's hard to see when you've gone too far. Each procedure seems reasonable in isolation. A little Botox here, some filler there, maybe a small nose refinement. But these procedures add up over time, and suddenly you're looking in the mirror at a face that barely resembles the one you were born with. What makes these transformations particularly sad is that in most cases, these women were beautiful to begin with. They didn't need all this work. But the pressure of being on television, combined with the easy access to procedures and the normalization of plastic surgery in the housewives culture, created a perfect storm for going too far. Many of these women have expressed regret about specific procedures. Brandi admitted to overfilling. Kim appeared on a show specifically about reversing procedures. Tamra has discussed regretting her liposuction. But even acknowledging the problem doesn't seem to stop them from getting more work done. It's a vicious cycle where they try to fix bad procedures with more procedures, leading to an increasingly unnatural appearance. The lesson here isn't that plastic surgery is inherently bad. Many housewives have had work done that looks natural and age-appropriate. The lesson is about knowing when to stop. about finding a surgeon who will say no when a patient wants too much, about accepting that aging is natural and doesn't need to be aggressively fought with every tool available. These 7 housewives serve as cautionary tales for anyone considering cosmetic procedures. Start conservatively. Find a reputable surgeon who prioritizes natural results. Know when to stop. And remember that sometimes the best procedure is the one you don't get. Because once you've gone too far, it's incredibly difficult to go back to looking natural again. The damage has been done, and no amount of reversals or corrections will fully restore what was lost. From Kim's unrecognizable transformation to Brandi's overfilled disaster, these housewives learned the hard way that more plastic surgery doesn't equal better results. They went from naturally beautiful to obviously artificial, proving that knowing when to stop is just as important as knowing when to start. What do you think? Comment below.